And up next, we have an amazing panel here. Our next panel focuses on self-advocacy, using your voice, sharing your story, and standing up for your rights. Matthew and Saida each bring different experiences with advocacy through public speaking, legislation, disability services, identity, and everyday life. Their stories remind us that advocacy can happen in many different ways. And first, we'll get to hear from Matthew. All right. Well, let's take a moment to just introduce both of you. Would that be okay? Would you be willing to share your names, your pronouns, and what brought you here today?
Hi everyone. My name is Saida Mahoney. I'm 29 years old. My pronoun is she, her, but I use many other ones as well. And I live in the Bay Area, and I'm happy to be here today.
Woohoo! Let's give it up for Saida.
Hi, my name is Matthew Crome. I'm really happy to be here today. I've been a regional center client for about 2 years now, and I've been involved with Tusa for about 6 months, roughly. So yes, I'm very happy to present here today.
All right, let's give it up for Matthew and Saida. Hee-hee. And since you have the mic, Matthew, would you be willing to share a little bit more about the right to agency for IDD adults?
Yes. I've been so today I'm going to present on agency and when it comes to disability services for adults with IDD who are in services. I'm going to speak regarding my experience in day programs and receiving services through the GGRC. And sort of a call to action for what I would like to see in terms of changes and in the future. May you go to the next slide? Sorry, I'm having a little trouble holding fast talk.
Yeah.
So I've been a client of GGRC services for about 2 years. I started receiving services officially October of 2024. I actually graduated from community college in 2023. I worked as a registered behavior technician for about 1.5 years. I also worked as a direct support professional at a summer camp in 2023. Currently, I am involved in a day program. I'm involved with a program called Integrated Community Services and involved with a program called Lifehouse. And I've been involved with Tusa as well. My goal currently, so I'm a student, a part-time student at SF State. My goal is to receive housing first in Marin and then eventually in San Francisco so I can live independently and return to SF State full-time and complete my degree. I want to talk about agency, the right to make choices about your own life. Sorry, I'm still hearing a lot of crosstalk. Yeah.
Yeah, but we're going to make another announcement, just a kind reminder and a kind invitation. At this time, if you're having any conversations, just bring them to a stop for now. Bring them to a pause for now so that we can really bring some attention to our speakers here. That would really, really be appreciated. And if you want to have a conversation, please have it outside of this main hall and vendor space. There will be another opportunity to connect with the vendors between sessions. Thank you so much.
Um, uh, so in a lot of day programs and services that I've noticed, particularly for people with intellectual and developmental disabilities, the decisions get made for people. Staff assume what people want, and it becomes about the staff more than the individuals receiving services. It can feel very disrespectful, very frustrating, very dehumanizing, and it can be a hindrance to progress in disability. So it took me 5 years to get signed up for regional center services. I really was not familiar how the system worked. I was not in a lot of disability services growing up, so neither myself nor my parents nor anyone who knew really were familiar with the system. There were a lot of barriers. I felt just stuck in limbo for, again, 5 years. And that's an ongoing struggle now that it's past the GGRC. It's now with Social Security and will likely be ongoing with services for a long time. A lot of barriers was I was late diagnosed and was not as severely disabled as a lot of clients, so they did not really consider me eligible for a long time. But getting access to services can feel just exhausting, and it can feel sometimes like there's no hope. But once I actually got into services, I noticed that the reality was very different from what I was pitched from my expectations. Services are often described one way, but they often end up being a lot different than how they're presented initially. There's a lot less choice, there's a lot less independence, and you often aren't listened to. A lot of clients especially aren't listened to. Sometimes the parents aren't listened to. A lot of times services will say something like, we are a program for adults, we treat our clients as adults, and then they will treat clients very much like children. Often staff will decide activities. You'll be told what's best as opposed to being allowed to do things your way or being allowed to add your own input. There often won't be flexibility in what you can do. Often you'll be talked over or talked about instead of being talked with. Next slide, please. One thing that I've experienced in disability programs is a fear of speaking up. I am somebody who very much likes to advocate for myself, but I get worried that my staff will treat me differently. I'll get labeled as difficult or having behaviors instead of raising legitimate complaints. And then I'll worry that services will get worse as a result. People should not be punished for advocating for themselves. Often there's a lack of reporting options. People don't know who to talk to, how to file complaints, whether they'll be believed, whether they'll be dismissed. One example is that I've had a lot of trouble with paratransit transportation. I've had a lot of trouble getting the proper transportation that gets you the right time. I had a recent, very scary safety-related incident on paratransit that was not handled well. And this is a major concern for the disabled and also for the elderly community because paratransit services that too. Because that affects whether you get to your job on time, your education, getting to doctor's appointments, for instance, your independence in general, your social life. When your life is completely dependent on transportation, and that transportation often does not do what it's supposed to do or what it needs to do. Next slide, please. Why agency matters. I think that all of us should have as much agency as our disability allows and as we can be allowed. People with disabilities all have goals, we have dreams, and we have futures. services are meant to help us move towards those goals and not hold us back. For my goal, I'm at the level of independence where I may need services all my life, but I would like to not need services all my life if that's possible, and I would like to move towards that independence. Currently, I am fighting to receive SSI, and that means getting housing once I get SSI. Once I get housing, eventually I'll move into San Francisco and be able to return to SF State and sort of pick up my life from there. And so independence requires support systems that would allow me to do that and then actually work. Agency looks like being asked what you want, having real options, being included in decisions, being respected even when your preferences differ from what the staff wants or what's convenient for the staff. I would now like you to turn and talk, if any of you are in the audience, to the person next to you and say what helps you feel heard and respected. I'll give you 1 minute. Next slide. Yeah, next slide. Oh, I don't know why that didn't end it. Okay, I'll give you 1 minute to talk to the person next to you. What helps you feel heard and respected? What helps you feel heard and respected? Sorry. Good. Yeah, one of them is now done. Yeah. Okay. Okay, is everyone done? See the person next to them. Oh, sorry. Oh. Okay, so I have some recommendations and solutions for staff and caregivers, particularly. Support should be person-centered and not staff-centered. Some recommendations I would have would be to check in with the person regularly, ask them what they actually want. If they have trouble with communication, try to give them options, try to work within what they can choose, and to give real options and not kind of, a lot of programs will give limited options or, sort of assume that it's, kind of lowest common denominator. And don't make decisions based on staff convenience. If a choice isn't possible, it's good to work on a compromise and work together. More training, some staff training ideas for staff programs and for individual staff is more training on autonomy, communication, disability rights, and supported decision-making. One program I'd recommend is Open Future Learning. They are an online program. You can access, I believe it's $20 per month per individual, but there are discounts you can get for organizations. And just general overall to disability programs, programs should be more thoughtful about who they hire, because it takes your heart has to be in it to work with people with disabilities. You have to be willing to sacrifice a lot, and you have to be willing to kind of put the needs of people with disabilities over yourself and to treat everyone as an adult and with respect. My recommendations for people receiving services is to know you have the right to speak up, practice setting boundaries, learn phrases for advocacy, ask questions, bring supporters if you need somebody to help support you, and your voice matters. Having support does not mean you should lose your right to choose, or that you should have your independence restricted when it doesn't need to be. That's something that was kind of a whiplash I noticed going from not being in services to being in services, is that my world kind of got a lot smaller, and what I could do got a lot smaller. You can go to the M slide. Yep. So I, in the future, am interested in co-leading Choices, which is an advocacy program with Tusa, getting more involved with disability advocacy and community education. One resource I draw from is Seattle Children's is a hospital that has the broadcasts online, these conferences talking to with all these sorts of subjects, particularly about autism and about disability, all the challenges related to disability, a lot of input from advocates with disabilities and family of advocates with disabilities, and talk about all kinds of severity and types of disabilities. My sort of final takeaway is real inclusion means people with disabilities are not just present. We are listened to, respected, and trusted to lead our own lives. Agency in making choices for yourself in your life is not a privilege, it's a right.
Thank you.
And now I'm going to pass the mic to Saida, who will ask me some follow-up questions.
When did you first realize your voice mattered?
Sorry, just, okay. I realized my voice mattered when I was able to actually affect change, not just within disability organizations, but in other examples in my life. For example, starting when I was about 8 years old, I wanted to help cheetahs, because cheetahs were my favorite animal at the time. And so I started a fundraiser for them at my local festival.
What does it feel like when people make assumptions about what you want?
It feels frustrating. It feels dehumanizing, and there are a few less dehumanizing ways to treat someone than to treat a fully grown adult like they're a little kid, and that's definitely something I've experienced in disability services.
What helped you become more confident speaking up?
I guess just practicing it, and sort of when I wasn't being listened to, just continuing doing it.
What keeps you motivated to keep advocating when systems are frustrating?
Just sort of trying to create a world that works for me. I suppose, just out of necessity.
What changes will make the biggest difference for people with services?
I think some of the things I mentioned. I think training staff properly, overseeing staff properly, having a more organized, overarching angle to disability services, and again allowing people in disability services to advocate themselves, and treating work in disability services as not just a job, not just something that you're being paid to do, but something, again, a calling.
What do you wish staff understood better about autonomy and respect?
That just because, for instance, someone has an intellectual disability and they may behave in ways that may be childlike, that does not mean they are a child. All of us are adults. Everyone in the disability programs that I've been in, regardless of their cognitive level or their strengths, weaknesses, or types of disability, are adults. And obviously, people have different levels of autonomy. That does not mean assuming things for people. That does not mean belittling people.
You mentioned fear of repercussions. Why do you think so many disabled people are afraid to advocate for themselves?
I think a lot of people with disabilities sort of have a learned helplessness when you expect, stuff to be done for you and for you to be treated like you have no autonomy. Sort of internalize it, and you you sort of become conditioned. So I believe it's your turn to speak now, Said. Let's give the floor to Said.
Matthew, I have a follow-up question for you. Would that be okay?
Yes.
I heard you say that you would like to go back to school as part of your plan. I'm curious, what would be some of your plans when you go back to school, your plan of study?
I'm currently about halfway through my bachelor's degree. I graduated community college, but I'm kind of in progress on a lot of associates. I have 3 so far. My bachelor's is in psychology, and I'm also studying film and data science at SF State. I do intend to go to grad school at some point afterwards, and my intent is to work in the disability advocacy clinical research.
Amazing. Thanks for sharing about some of what you've done already and some of your dreams, hopes, and plans. I'll give the mic over to Saida.
Hi, everyone. My name is Saida Mahoney, and I am 29 years old, and I live in Oakland, here in the Bay Area region. It's not far from San Francisco. It's only 11 minutes away across the Bay Bridge. And for those of you who don't know where Oakland is, I was born and raised there, and I was raised by a single mom. She did a wonderful job taking care of me, raising me, getting me through everything, my good times and rough times and my best moments and worst moments in my life. And I'm very thankful and grateful for her. I am Jewish, and I am a person with disabilities, rare diseases, chronic medical conditions, and I also live with chronic complex mental health disabilities as well. But I don't let none of them stop me or discourage me in any forms of way. I am very proud to be who I am and what I am and what I'm about and how I represent myself everywhere I go. I am proud to be a multi-identity member of the LGBTQ community as well, and transgender, and I am very proud of it. I love what I am and how I represent myself, and I don't back down for nobody. I don't put myself in no position to make somebody feel happy or accept me for who I am, 'cause that's not how it goes. I love to be who I am, and I live it bravely and fully authentically as a person with disabilities, and they do not discourage me, not one bit. I have faced tons of discrimination in all forms of ways. Friends, I lost tons of friends because of how I am. I lost the ability to do a lot of programs, academics, college, universities. I had to overcome the struggles of continuing my education because nobody did not want me to come no more. I had gotten ultimatums where I had to either stop being a LGBTQ community member, a transgender, if I wanted to get my degree, or I could continue to live myself authentically and not have a formal degree. So I went with that option, but I built myself up more. I am a national disability advocate activist. I am a national rare disease advocate activist. I am a national human rights advocate activist. I am a podcaster. I'm an author of 13 books. I am a writer. I do performing arts. I do music, dancing, theater, songwriting. I also do filmmaking. I do digital media. I have had my whole entire platform for 19 years, be 20 years in 2027. I started everything up as my own independent person. I've been doing everything since I was 12 years old. I started writing professionally at 12, and I branded my own writing at 19 years old. And I just get on there and write about anything and everything. I love to express myself. I love to educate the public about how people with disabilities are fully able of everything. And just because somebody has challenges doesn't mean you neglect them or exclude them from anything. You listen to them and pay attention. I also have wrote about my journey of being a person who have disabilities, rare diseases, medical conditions while navigating my life through my gender affirming care, and why it's important to not let your diagnosis discourage you from doing it. I also am an athlete. I am proud to be an athlete. I am doing it while I'm doing my HRT journey. Then there are so many people that try to exclude somebody who is transgender for doing athletics, and I am breaking the barrier that it shouldn't have to do that at all. I am living proof of it. I got silver medals and gold medals, and I've been traveling. I have traveled to 49 states advocating for the whole entire community. I do it all by myself. I am planning on going to my 50th state soon, and I am proud to have my genetic condition. My genetic condition I was born with was called partial trisomy 8q duplication syndrome. For short, is partial trisomy 8q. It affects me in all areas, in all ways, but I don't let it discourage me not one bit. I am defining what it means to live with it. I am defining what it means to have all my abilities and all my capabilities. I do not focus on my disability. Rather than focusing on the disability, I focus fully on all of my abilities, my unique ones, my powerful ones, strong ones, everything. And I am proud to be my mom's daughter. I'm proud to have a single parent raise me. My mom did a wonderful job, and I'm thankful and grateful for it. I learned how to become stronger because of her. I am more resilient because of her, and I'm more courageous than ever as I get older. When I am 29 years old, be 30 in September, but I am still using my voice to educate people, and I plan on doing it more as I get older, and I love to use my writing to help people. My podcast channel is in 48 countries. It is in all over the United States and overseas. The new country that has picked up my podcast channel is Israel, Canada, Japan. It's also in India. It's also in Ukraine. And I use it to help the disabled people who are overseas that may not have that much support. And I've been doing my podcast channel since 2021. I'm currently on my 13th season. I'll be on season 14 in June. And I've been doing everything I can to help make a difference in this world.
Okay, so thank you for your presentation, Saida. Can we have another applause? I have some questions to ask you as a part of the panel. First off, how have your identities shaped your experience advocating? How have your identities shaped your experience advocating for yourself?
My identities have shaped me because they help me see how it is in the world compared to that I also have a bigger picture of what it means for people to live my identities that have disabilities and medical conditions and or rare diseases that have is medically fragile, medically complex. And I also see how those who do have identities live that are not disabled and don't have medical conditions and are not medically fragile. And I learned how to use my voice to help strengthen the community and educate people that it is so many people who have the identities, but they know how they are. Everybody have their own unique way how to identify themselves. There's no right or wrong way to do it. Everybody is different in their journey, where they are in the process. And I am proud to be who I am with it. And I am use my voice to educate my medical team and how they gonna have a lot of patients who are part of the community with all the identities, who have disabilities, rare diseases, chronic medical conditions, but it does not mean to neglect them or exclude them, just include them in everything, and that they know what they are doing.
What does it mean to be fully seen for all parts of your identity? Okay. What does it mean to be fully seen for all parts of your identity?
Being my full authentic self and using my voice to be as loud and courageous as I can, and uplifting it for everybody everywhere and not being silent. I use my voice to educate people, and for those who don't want me to use my voice, I write them pamphlets and send them emails, text messages. I have my own thread of what I do, and I send it to everybody, and I've been to people's jobs advocating. I go to everybody clinic advocating, and I also work with our elected leaders to help bring better change and awareness in this matter, and that it's okay for a person to not know, and it's okay to ask, and there's no right or wrong way. Nobody's not hurt. It don't hurt nobody. Don't harm no one. And I use my voice to let people know that it's okay. There's no bad thing behind it, and it's all positive and love with it.
What was it like the first time you spoke publicly or lobbied legislatively?
It was very, very challenging at first because I started here locally in the Bay Area advocating and work with our elected leaders. And then I end up, then I did more work. And the stuff I took from them, I learned and got better with it. And then I end up going to Sacramento to our state capital. I don't mind who I'm working with, Democrat, Republican, it does not matter. What do matter is helping bring the change that we need and awareness. I do not care what their political status is. I'm not there for status. I'm there to help make a difference and help bring positive change to the community and make it stronger as best as I can and any way I can do it. And I went there, and then I ended up going to more state capitals out of state. And then I ended up going to Washington, D.C., to the White House advocating. I've been to the Capitol Hill, been to the Senate building in D.C. I've been to the White House a lot of times to help people. And I have been to 49 states and all state capitals advocating and working real close with our elected leaders. And I do Zoom meetings with them. I do panel discussions with them. All the hospitals and clinics, social workers, counselors, the assembly members, Congress members. I even worked with Nancy Pelosi a couple times, help bring change. And I worked with Dianne Feinstein before she passed away to help strengthen the community. I also worked with Republicans to help them understand that they should be more inclusive and helpful and accepting. I just work with anyone who I can work with. And my experience had taught me a lot of stuff. I learned from everything. I learned from my challenges. I learned from my mistakes. I got better at it. And I just go out there and educate other people and do what's right and fight hard and battle. And I never back down.
What advice would you give to someone who wants to advocate but feels nervous?
You can start off as little or as much as you want. Don't give up. Practice. Do what makes you feel right. Do it because you want to do it from your heart and soul. Don't do it because somebody else do it. Make sure you want to do it for yourself first. And you can always do it in many ways you want. You can get creative with it. You can write. You can do your own podcast channel. You can also educate your neighbors, do rallies. You can make pamphlets and send it to your friends. You can start off as small at your doctor's office. You can start with your primary doctor or anywhere that starts make a difference.
Okay, we have 1 more minute. I'm actually going to turn the discussion to the audience. What's one change you want in your life or your community?
Yeah, you're not not. Hi. Okay. Well, my thing looking the deep in the start more and I will not thought in the money that I'm not in that a don't go out my my no my and one one to be done. However, the more not human about but one
Sure, I can answer. You always be patient with yourself and be kind with yourself and don't never give up. There is plenty of time where that you can do what you want to do. You want to make sure you are comfortable, but most importantly, you want to make sure you are in a safe environment to do what you want to do. Make sure you're in a safe place and you have a safe group of people who are on your team, because that's the number one thing. You gotta make sure you are safe inside and out. And once you do that, you can do anything you want to do and do anything you want to put your mind to. Just be positive, never give up, dream, and fight for what you want to stand up for.
I would say when it comes to disability, I've heard of this concept called the dignity of taking risks, which means that we all have the right to take risks in our lives, and of course that's going to come with consequences, but we deserve to be informed of the consequences, and for lack of a better term, we deserve not to be, padded constantly and just not allowed to explore risks. And I would say for staying committed to one thing, that's a thing I have challenged with too, because I'm all over the place. I get super ambitious with my goals. I would say breaking things down and having clear steps and ways to prioritize things. I think a lot of people with disabilities struggle with executive functioning, which is something I'm trying to get help through services for, because that's a big obstacle in my life that comes with my disability. So. Oh, sorry. Here we go. What is one change you want in your life or your community? Sorry, can you repeat that? I didn't quite hear that. Oh, okay. Yeah, I think definitely something that I want to get involved with is disability research, which is, helping a lot of the challenges that come with disabilities and preventing or treating a lot of those challenges. So, we can make our lives easier.
Thank you.
All right. We are about to wrap up this panel. Do you have any final words or thoughts that want to be said?
Never give up and don't let your disability define who you are. You define your disability all the way inside and out in everything you do. Then you are full of abilities, capabilities, inside and out. And don't be afraid to let all your uniqueness shine wherever you go in the world, whenever you travel with your friends, your mother, or anyone in your family. Your parents are your number one cheerleader. Your mom is number one cheerleader. She have your back through and through, and they know what they doing. Moms know, and they can help you get through everything, like myself.
Thank you.
Thank you. Any last words?
Remember that you have a voice. You have the ability to advocate for yourself. You have the ability to reach out to the people. If you are a recipient of services, that means you should have the right to decide your services. And of course, you can't just get whatever you want, but you should get what you need to succeed in life and to achieve the goals that you want.
Come and give it up to our panelists. Woohoo! Saida and Matthew. I want to thank you for sharing about your advocacy journeys and your leadership journeys for people with disabilities. I learned so much from your panel and your shares today. Thank you for your heart. Thank you for your spirit. Thank you for all of your work and your advocacy and inspiring us to do the same in our own lives. So thank you, Gay. Thank you. Let's give it up for them one more time. Woohoo!